Hi, I'm Christine Ellis, the National Secretary of the Transplant Nurses Association, and together with Transplant Australia, TSANZ and supported by Stellis Pharmaceuticals, we're going to chat to you today about ways that you can stay in contact with your transplant unit during this difficult time. I'm a renal transplant coordinator, and along with my colleagues from other organs, we've put together some tips just to try and help give you some guidance of what to do with this present situation. We know that everybody's anxious, and we all are, but especially our transplant patients concerning about coming into hospitals and how to do things, because things have changed for us. One of the important things to know at the moment that we are still your point of call, and that has not changed. We are here for you, we're here to support you and guide you just like we always have been. Although things are a little bit different at the moment. I'm very used to my patients popping into clinic and us being able to chat face to face, or them dropping into the office when they have concerns, and now that's not so frequent. Now what we're doing is we're using telephones, video conferencing, emails, other forms of ways to contact you. So it's really important at this point in time to keep your contact details up to date. Make sure your phone numbers are correct and that the units can get hold of you. Make sure you keep your email contacts up to date. If you haven't used email previously, email is a really good way of communication. Dr. Toby Coates has already spoken to you about some of the things you can do to make your telehealth clinic appointment more efficient in the way of taking your temperature and your blood pressure, doing a weight at home and having these things ready for the consultation for the doctors, and that's very useful information to be able to give them. There are some other things you can do as well. Have a pad and a pen by the phone so that you can write down some questions so you're ready for your consultation, or you can write down some of the points that the doctors might talk to you about, because we all know even normally face to face you leave the clinic room and often you forget what the doctor might have spoken to you about. So a pad and pen to make some notes is a really useful thing to do. The other thing to do is check your medications. Dr. Coates also mentioned about not stockpiling, and we would really ask that you do the good routine things you've done with your medications previously. Approximately 2 months supply is more than enough at this point in time. But what I would encourage you to do is check your scripts. Make sure they're valid, that they haven't expired. Remember, it's 12 months from the original date that the doctors have written the scripts for you. Make sure you do this not the morning of when you take your last pill and you're ringing up saying, I've run out. Ideally, at this point in time, we do need some notice. Check with your transplant unit and your transplant nurse what the policies are for your hospitals. A lot of the public hospitals at the moment are posting out medication to help you so you don't have to come into the hospital. The other thing, the community pharmacies will also provide the same service. And if you haven't used your community pharmacy before, you might want to call them and just check in regards to the brands they have of your immunosuppressive therapy, because we don't want you changing brands at this time. It's very important that you stay on the same brand that you're taking. It's also very important at this time not to stop taking your medication, not to think you can change the doses and that might help your immune system and prevent you getting infections. Please do not alter your drug doses unless it's in consultation with the medical staff. The other thing to think about is blood testing. Usually we would ask you to have your blood tests done before you come to the clinic, and that's still very much the case. But again, some of these processes have changed. Rather than turning up and taking a number and waiting in line, the pathology departments are asking for you to make appointments. So again, you need to check with your external pathology service if that's what you've been doing, or check with the hospital pathology service about making appointment times so that they can minimise the flow coming into the hospital and maintain the social distancing guidelines. The other thing that's important is if you've got other investigations, perhaps you might have a CT scan or some cardiac monitoring that was booked. You need to check with your transplant nurses regarding these appointments. Don't cancel things because you don't want to come to the hospital. If they're routine and they're not considered urgent, then the transplant nurse will be able to reschedule the appointment for you. But it might be that you still need to have this test. And so talk to the transplant nurses about that. If you do need to come into the hospital, it is quite safe, but the processes again have changed a little bit. Most of the public hospitals have one entrance and one exit point. So when you come into the hospital, they'll check your temperature and do a quick screening process. Your carer also cannot come with you unless it's absolutely necessary. So if you've got a physical disability, or you might have a language issue, and you require your carer to help you, that is fine. They will still be allowed to come into the hospital, but you won't be able to bring the whole extended family with you for a hospital trip day out. That's not allowed. Ideally, we are only encouraging the person that needs to come into the hospital comes in. And again, that's to help along with the social distancing guidelines that we're practicing at the moment. If you need to come into the hospital as an inpatient, and I know a lot of patients, I've had a lot of phone calls from my patients, they're worried about being in contact with somebody who might have COVID-19 and be positive. This is not the case. It's quite safe to come in. The wards with the patients that have got positive COVID-19 are well isolated away from the rest of the hospital. You won't be sharing a ward or sharing a 4-bed section with somebody who's tested positive for this virus. So it is safe to come in if you need to do that. The other thing we're noticing at the moment is there's a lot of information out there. There's a lot of things on social media. There's a lot of things. John Smith down the road's probably telling you what his friend told him. Please try and stick to good information as your source. The Government Health website has a very good facts and answer question sheet, and we're going to put that link up for you as a reference. Transplant Australia, TSANZ, Transplant Nurses, all have information along with your units, and you may have already had some information posted out to you to use as a reference tool. Another little important reminder is, just like in previous years, it's exceptionally important for you to get your flu vaccinations. So previously you might have done this at your hospital clinic. Again, check with the nurses in your unit to see whether they're still providing flu vaccinations, but majority of public hospitals at this point in time are encouraging the patients to go to their local GPs or to the chemist to get your flu vaccination. So just check with your transplant nurse in regards to that. And if you're also due for your Pneumovax vaccination, organised to have those done as normal. That's still very important for you. Ultimately, the best thing that we can say is, as nurses, we are always here for you. That is our job, and none of that has changed. So please, if you have questions, concerns, contact your transplant nurse in your unit for the specific things that are relevant to you at this time. We want you to stay well, follow all the guidelines about social distancing, stay home when you can, and most importantly, wash your hands. We know that's our best tool against infection. Nurses have been washing their hands for years. It's the best thing you can do to prevent infection. So hopefully we've given you some helpful advice today, and we'd like you to stay safe and take care. Thank you.